Impulse buy ratios. One more thing before we get right into it, because this is important to keep in mind. Let's talk about Ed made a joke that I love to shop. Of course we do, but I think the biggest reason I love to shop is because I just love to get a good deal. Don't we all love to get a good deal? Looking for the bargains, okay? Impulse buy ratios. We all have a certain ratio within our minds, within our emotional decision-making process that that we follow when we go shopping. If we go to the convenience store and you're looking to you go and get gas, you run in for a soda or whatever, what are you willing to spend on your impulse buy? Just throw out a number. $5, right on, okay? $5. Nordstrom's. We got Michigan Avenue right outside, okay? If we're going to be strolling up, going into a higher-end department store, what do you think that ratio is? This part is always funny because the women say numbers that are completely different from the men. You know, $100, okay? What would you have said? You mind? 10? $10? See what I mean? It's funny. Anyway, it's funny to me. It makes me laugh. But the actual national average that they talk about is between $50 and $60. That's what the impulse buy ratio is in a department store. Well, what does this have to do with dentistry, right? What do you think it is in your office? What's your patient's impulse buy ratio in your practice? And here's where I get the $10 copay. Okay? Very, very close, right? Between $300 and $500. In fact, it's probably right there. Okay? So, what does that tell us? We're not helping our patients capitalize on those impulse buy ratios very often in dentistry with the current model. And that's one of the reasons that some of these things that we talk about today work so well, is that it's right in that range. What fits within that range in hygiene that we're doing? Pretty much everything, right? The only exception would be the full-blown perio treatment with no insurance. But even a patient that has full-blown perio treatment and insurance, it's still usually their out-of-pocket is right in between that range. Okay, so that's why I bring that up. That's why it's important to focus on that. Okay, let's talk about fluoride for a few minutes. Now, some of this, for those who have been members just for a few months, you may have listened to one of the phone calls. We've had fluoride phone calls. So if I'm telling you information that you already know, bear with us here for a minute. But it's important for us to review it because a lot of us, the feedback that we're getting from members is they don't even know really where to start. And this is where I'd suggest that you start. Start offering fluoride to your adult patients. Okay? Very easy to do. Very few offices are actually doing it. And some offices have been doing fluoride for so long that it's kind of just natural. It's just part of what we do. Can't believe that there are people out there who aren't doing it because it's so easy to do. Okay? Why don't we offer fluoride to adults? Okay? Okay? That's why we should offer it. Why do we not? We think they won't accept it because it's not covered by insurance. Okay? So really, what's the main reason that we stopped offering fluoride to adults? Or, okay, let me also suggest that some of our patients are confused about the difference between systemic and topical fluoride. Systemic fluoride does not affect adults, right? You can only take it up till the time you're 12. After that, it's not going to help you anymore. So I think there's a misconception in the general public about which fluoride we're talking about. Okay? Topical fluoride, CRA studies show that it will help everybody, whatever the age, 2 to 92, 102, it doesn't matter. If you have teeth in your mouth, we should be trying to strengthen them as often as we possibly can. Okay? Helps prevent cervical decay. It reduces sensitivity. It can prolong the life of crowns. A lot of these things are no-brainers, right? Well, why aren't we offering it? It's not part of our system. It's not part of our structure. We think maybe we've been, we've had patients that haven't accepted it in the past, and nobody likes rejection, right? So maybe we offer it a few times, don't get good results, and we just quit, even bringing it up. Well, when it's prepared or when it's presented properly, a lot of offices, a lot of patients really like fluoride. It tastes better than it ever used to. Remember those treatments when we first started, like 4 or 5 minutes long, the stuff tasted horrible, okay? So a lot of times when you present that to patients, if you haven't told them, hey, it's better than it used to be, this is what they're thinking. Oh, sorry, hang on. Now we lost the momentum here. I was trying to turn the volume up for you. Okay, here, I'll do it again because that deserves repeating, wouldn't you say? Okay. That's great, huh? Don't start puking. No. So what does it mean? What does it mean for hygiene profitability? If the average office sees 8 patients a day, And we do average fee for fluoride from what I've seen is about $25. Just to let you know, I recommend you keep your fluoride fee in the $20 price range, just because if you're charging $39, you're going to have a lot fewer patients accept it. Your cost, hard cost on the fluoride treatment is $1 on average. Not to count employees' time, but that's what your physical cost is for your material. So if you have it between $20 and $30, you still have a nice profitable margin there. Okay? So if we do that on average, and we're not going to count 100% acceptance, I'm usually I'm presenting, when I talk about numbers, I don't want you sitting there saying, that wouldn't work for us. We couldn't get that many people to do it. So I always estimate low. Okay? Always estimate low. So with 80% acceptance, which you should get if you're working on your verbiage and some of the scripting, which I go over a lot on some of the audio calls that are available on the Navigator. So Darcy can help you when we talk about how to find things on Navigator. We'll make sure you know where to get those training calls if you were not able to listen in, because there's really good information there. Okay? So just that said, with 80% acceptance, we're looking at an increase of more than $30,000 to your practice over the next year, just with offering fluoride to adults.